Helping you live healthy. From spicy foods to peanuts, what you could eat could cause trouble with your digestive system. At least 50% of the population over the age of 60 has diverticulitis. So what is it and how can people find relief? Dr. Alex Crean from Memorial Hospital joins me now. Good morning. Thank you for being with us.
Morning, Jen. Thanks for having me.
What is diverticular disease?
That's a great question. So diverticular disease is when we develop small little pockets or outpouchings on the colon. We're not exactly sure what causes them. We know there's a genetic component to it and then a lifestyle component as well.
Are there any risk factors?
Yes, absolutely. So believe it or not, even though it's a benign condition, this can run in families. Other risk factors can include smoking, constipation, and then some dietary issues as well.
What should people look for? How can they maybe recognize an attack of diverticulitis?
Great question. So typically when people have diverticulitis, it's going to affect the left side of the colon. So they're going to have pain near their left hip. They may have some bloating, even change in bowel habits, and then fevers as well.
At what point should someone who is experiencing some of those symptoms, because some of those symptoms sound similar to what you may experience from maybe just a stomach ache or eating something that didn't sit well with you, at what point should they seek medical attention or guidance?
Great question. So if really the pain is persisting and they're not able to eat or drink anything, especially if not even liquids, if they're having significant fevers, definitely a sign to go seek out care either with your primary or with an emergency room. And if they're having any bleeding as well, something you want to get checked out.
Are there certain foods that people should stay away from that could maybe trigger an attack?
Yes, definitely. So when you actually have an acute attack, things that are harder to digest, like things that are high in fiber, even things with seeds or nuts can trigger it. But long term, we don't think that causes diverticular disease so much anymore.
What are the common treatments?
So initially, the treatments are usually just backing off to a liquid diet. Sometimes you can even get through an attack without antibiotics. This can also include the oral antibiotics. And then for severe attacks, sometimes people need to be admitted to the hospital for intravenous antibiotics or even surgery.
How frequently do people typically get these types of attacks?
They're fairly infrequent. The majority of people walking around with these little pockets don't even know they have them. But the attacks are becoming more frequent within the U.S., but we are getting better at treating them as well.
Where can people go to learn more information?
Great question. So you can either speak with your primary care physician, your gastroenterologist, or your colorectal surgeon like me. We have a good amount of information on our website, www.masjax.com as well.
Dr. Crean, very good information this morning. Thank you so much for being with us.
Great. Thank you for having me.